Discharge Messages is another component of the Safewards package. We hope this presentation shows how easy to implement and how effective discharge messages can be on your ward in reducing conflict and containment. Hearing a message from somebody who has been in a similar distressing situation and has recovered is often the person who can give the most powerful messages of hope and reassurance. This is the principle underlying discharge messages. Many patients are admitted in a state of depression and hopelessness about their situation, despite it sometimes being covered with anger and resentment. There are many ways of assisting patients to regain hope and get a sense of purpose about what their admission is for. This is one way for patients to regain hope and reassurance through the experience and lives of their fellow patients. This intervention can be implemented in 3 easy steps. Firstly, when a patient is being discharged, if they wish, ask them to choose from a selection of postcards. Then ask them to write a positive or inspiring message to help current and new patients to the ward remain positive. This could include things they liked about the ward or staff, and if possible, include their most positive and helpful pieces of advice. Staff should be on hand to give support to patients who may find it difficult to write the message. It is best for the patient to include their name so that those remaining on the ward will know it is from them. Many wards find it a great part of introducing patients to the ward. Remember the importance of these messages only being positive so that they instill hope. Finally, the postcard should then be hung on the discharge messages tree. Wards have said some useful ways to ensure that all patients have the chance to write a message before they are discharged is to identify these patients at handover or bring a postcard into ward rounds. We know how individual all wards are, which is why this intervention fits so well. If a tree would not be suitable for your ward, look at how the other wards changed it to adapt it to work for them.
I have noticed the patients wandering down to see the board and read the messages. It seemed like a really lovely thing for the patients to read.
We hope this shows how simple discharge messages is to put into place on your ward and how valuable it can be for your patients.